right. All right, y'all. It's been a minute since I have gone live. I just been super busy. So what we are going to do, we're going to get started here with this COVID conversation really quick. Um, but before we do, just some housekeeping rules. We are going to be streaming live, and for those of you that are tapping in, you have the ability to actually ask questions and interact with us in real time while we're sharing. I'm going to make sure anybody that is on the call right now, that is in my little screen, in my little world, that if you're going to be sharing from your phones, that you turn the volume down on your phones, because I am about to go onto the website and I'm going to start watching this conversation. And while I'm watching the conversation, I need to make sure um, that I turn it down so that I'm not. There it is, so that y'all can't hear me echoing. Wonderful. There I am. I see the conversation is live. Let's do this. So tonight we are going to have a COVID conversation. When COVID first hit during the pandemic, it took a minute for us to kind of, get into the rhythm of what was going on with COVID. It was crazy and nobody understood. It wasn't making no sense. So we were doing all of the stuff year one during the pandemic, and everything was shut down. Year two, we started, I believe it's called the Resilience, Alex.
Resilient, yes.
So we had some folks that, we were bringing in together, and all the CBOs got together, and medical professions and churches and stuff. I was so proud. I was proud watching folks come from all of their different corners and different, places, and collaborate in order for us to figure out solutions and answers for our community. I don't know what anybody else did anywhere else, y'all, but I feel like the San Joaquin County, like we rocked that. We did that thing right there and figured out what we needed to do in order to keep our folks informed, reach the community, get them the information that they needed, and get them access. Then the vaccine came out. And of course, we'll talk about the highs and lows of that another time, but that was spooky, scary, Mary. Remember, right?
I remember.
Pfizer. And that's where I was going, because that was like, no offense to nobody, but that was what, some of the fluid white folks was getting and stuff. And I was like, I want what they getting, because, surely they don't want to just die, right? And so if they're getting that, it must be okay. So they had Pfizer coming out, and then they had Moderna coming out. I don't know. I didn't even like the way Moderna sound. No shade. I just wasn't sure. So, I wasn't doing it. And then they had Johnson and Johnson. I'm trying to keep a straight face while I say that. And that's what they were sending out to some of the marginalized communities. I can understand the thought process, right? One shot, because we is kind of, hesitant to do a thing. So let's just knock it out with one. Then they had recalls, and folks was like, no, and it's just all spooky, scary stuff. So we made it through all of that. Then we started trying to figure out how to reach our communities, how to reach marginalized communities, how to get through some of the barriers, all of that stuff. And so we're still working and trading through that. And now I think we're in what? Is this year 3, Alex?
It is.
So now we're in year three with COVID. COVID ain't going nowhere. Unless somebody tell me different, COVID ain't going nowhere. COVID is here to kick it. COVID say it wants to live. Hey, it wants to thrive. Hey, it is insistent and determined. And so now we are here back in the end of the year having a COVID conversation, and we're going to resume these going down the line. So let me introduce to you the folks that I am rocking with this evening. I'm going to kick it over to Mary, have her introduce herself and tell us a little bit about her, and then she can popcorn it to the next person.
Nice. Thank you so much, Elder Tony. And thank you for holding this space for us. Hi, everyone. My name is Mary Davis. I am an outreach specialist with Public Health Advocates, and I work on the Reach COVID Flu Grant. So last year, you guys see me here with Elder Tony. We held several conversations. We invited a lot of community leaders on here to talk with us and update you guys. So I'm just excited to be back in this space. So thank you, Elder Tony. And I'll pass it over to Nicole.
Hello, everyone. Thank you for having us today. My name is Nicole McMorris. I'm with Public Health Advocates on the COVID REACH grant. Just very happy to be here to be a part of this conversation today and really focus and hear some feedback and also be able to provide some education to those in our community. So, thank you for having us, Elder Tony, and just happy to be here. And I'll pass it over to Alex.
Thank you so much. Again, I'm also very happy and honored to be here with you tonight. Thank you so much, Tony, for inviting me, and hopefully we'll be able to answer any questions that anyone has today.
We can't hear you, Elder Tony.
Right. I was like, what? It's mute. Okay. So tonight is a simple, straightforward, conversation, and it shouldn't take the whole time. We just wanted to make sure going into Christmas, coming out of Thanksgiving, that we provided you with some information. Our COVID conversations are hashtag COVID WTF. That was the youth came up with that, just so that y'all know. Elder Tony didn't do that. Not that I wouldn't have. I'm just saying, but I didn't. So it is COVID WTF. The WTF is play is what's the facts, right? Of course, they meant that WTF thing. Though. I just want y'all to know they was like, what? So COVID WTF, what's the facts? So this evening we reached out to Daniel Kim. At the Public Health Services, who is always, oh my God, shout out to Daniel. That brother is so accommodating. I appreciate him so much. And he was like, if I can't reach my staff because they were having internet problems, he said, I'll be there myself. But Alex called me. Yay, Alex, my hero. And she is stellar when it comes to just sharing the information. And so I want to make sure that I make space for her. She's going to give us an update just on some current information, current statistics and stats. She's going to let us know some of the resources that are available out there. And then if there are any questions, if folks tap in, she'll be available to answer questions. So, and I think Mary might have some questions too, because Mary's always fielding folks out for questions. So I'm going to turn it over, Alex, to you. Is that okay?
That's great. Thank you so much.
All right. Let me get to the beginning of your slides before I kick that in.
All right. Thank you. Just want to reintroduce myself. I don't feel like I shared my title. I'm with Public Health Services and I'm a public health educator. I work in our emerging diseases program and our emergency preparedness program. So I've been with COVID since last October. And then we're going to cover today a little bit about flu and RSV, which is circulating right now as well. So we'll get started. Tony, next slide, please. All right. So first and foremost, I wanted to say that we do have a San Joaquin County COVID-19 dashboard. It was created a few months ago and it's updated very frequently. So if you're ever wondering where we are at in the county with different things like caseloads or hospitalization rates, anything like that, you can visit our website, sjcphs.org, and then you can click data and reports. It's just on the top of the page, and then you'll find our dashboard there. So we are in the beginning of a winter surge right now. Our testing positivity rate is 10.5. So this is actually a percentage. This means that 10.5 of all tests that are being done right now, PCR tests, are positive. Our case rate right now is 13.9. Case rate is out of 100,000 people. So that means out of 100,000 people in our county, 13.9 of them currently are positive for COVID. Our hospitalization rate, we have 56.8 people right now in the hospital around the county. And currently we have 6 people in our ICUs. Next slide, please. So numbers to me are kind of arbitrary. It's hard to get a grasp on where we are when people just talk about testing positivity or case rates. So for me, I always like to look at these trends, these graphs. So these three graphs that we have, we're going to move from left to right, but I just want to share that I did grab this from CDPH, their state dashboard. And this is San Joaquin County only, and it's also only showing the last 90 days. So you can see on the left-hand side, this is our case rate. Again, that's how many people are currently positive for COVID per 100,000 people. So you can see in the last 90 days, we've definitely been on a trend up since we hit November. We've been seeing more testing positivity. I'm sure in your communities, you've been hearing more people get sick recently. So our case rate is definitely going up. The middle graph here, this is our test positivity rate. And of course, unsurprisingly, our test positivity rate is also going up. And on the right-hand side here, we have hospitalizations. So hospitalizations, same thing. The trends are always going to follow our cases. If our cases are going up, our hospitalizations are also always going to go up. Next slide, please. All right, so I want to touch on the bivalent booster right now. You might be hearing this in the news. It came out a few months ago. It's a brand new booster that we have available to us. Currently, this booster, only Pfizer and Moderna make it at this point. And it is available to anyone over the age of 5, as long as your last dose was 2 months ago. So that means even if you've already had a booster, you're eligible for this booster as long as your last dose was 2 months ago. So what makes this booster different than the first one? Well, this booster combines some formulas that were in the original vaccine with variants that are circulating right now. So that's going to be the BA.5 and BA.4 variants, Omicron variants that are circulating right now. So this is going to better protect you against what we're seeing people being sick with at this moment. So we're definitely suggesting anyone who's eligible to go ahead and get their updated booster when they can. All right, next slide, please. So I just want to make it very simple for vaccine eligibility. So who can get a primary series right now? Who can start getting COVID vaccines? Anyone over the age of 6 months. And who is eligible to get their updated booster? Anyone who's over the age of 5 who had their last dose at least 2 months ago. Next slide, please. Thank you so much. All right, so I want to talk about where can you get a free vaccination in San Joaquin County. So I always say SJ Ready is our one-stop shop for all vaccines and all testing locations around our county. It's updated constantly. So you should be able to go on sjready.org and find somewhere near you. And we have them weekdays, weekends, all hours. You know, if you're someone who can't go in the middle of the day because you're working, we definitely have different mobile vaccination sites that are open a little bit later. So go on there and check. And we're also offering flu vaccine at most of our mobile vaccine locations for free, no insurance needed and no appointment needed. Next slide, please. All right, so I want to plug our test to treat sites, but first let me explain what a test to treat is. So test to treat means that you can go to a location, get tested for COVID-19, be seen by a healthcare provider via telehealth, and then you can receive your prescription and medication on site, all in one place. So it's definitely very convenient. You don't have to make an appointment. If you have COVID symptoms, you go to a test to treat site, see a doctor, get your prescription, get out of there. And anyone over the age of 12 is allowed to receive treatment for COVID-19. Paxlovid is the most common treatment that we have. It's probably the one that you'll receive. You've seen it in the news. And it really can decrease the time that you are sick with COVID. So we're definitely recommending it to people. So you're not down for 2 weeks sick. You're only out for 3 days sick. Get your Paxlovid at a test to treat site. And it's very important as well that you don't delay. If you have COVID-19 symptoms, you're going to want to go to that test to treat site as soon as possible. Treatment has to start within 5 days of symptom onset. Next slide, please. All right, so where can you find a test to treat site? Again, sjready.org. It's the one-stop shop to find all of our test to treat sites. We have them in Lodi at the Lodi Community Center. We have one in Lathrop at the Lathrop Business Park. We have 2 in Stockton, one by our general hospital and one at the Kennedy Community Center. And then we also have one in Tracy at the Larch Clover Community Center. And again, these are all no insurance and no appointment needed. They are free. Next slide. All right, let's touch on flu for a little bit. I know we're getting a little graphy here, but on the left-hand side, I just want to point out, you can see in red that Southern California is experiencing very high influenza activity right now. We're still in moderate to high in NorCal, but it usually kind of migrates north. So we're definitely seeing an increase in flu activity throughout the entire state, but we are expecting that it's going to get worse here than it already is. So now is a great time to get your flu shot. Tamiflu is a common treatment for flu. So there's definitely, good methods, of course, flu shot to prevent. And if you do end up getting the flu, you can take Tamiflu and it can help with your symptoms. I want to talk about the graph on the right here because we've been seeing respiratory illnesses this year starting much earlier in the season than normal. And I'm sorry, it's a little bit small here to see, but you can see if you look at that dark blue line, that is this year. The other lines that we're seeing here are past flu seasons. And you can see that we're spiking much earlier in the year than normal. Typically, our spike has been from around mid-December to mid-March in past years. So we're definitely seeing it much earlier. So again, get your flu shot while you can. Get it before it gets worse in Northern California. Next slide, please. All right, I want to talk about RSV. I think this has also been in the news a lot lately, talking about this, which I'm glad because I think a lot of people don't realize how serious RSV can be, especially for our older adult populations and our young children. So what is RSV? Well, it's a respiratory virus that can cause mild cold-like symptoms, and it can be similar to what a common cold would feel like. And it also has similar symptoms to flu and sometimes COVID. But usually RSV, you can recover in about a week, but it can be serious, again, for small infants, young children, and older adults. There is no vaccine for RSV right now, and there's not a specific treatment. But you can treat the symptoms of RSV. So if you're noticing that there's a child is maybe not eating as much, they are very tired, they're having symptoms that are prolonged, they're lasting for more than a week, you're definitely going to want to contact your healthcare provider and see if you can get an RSV test, because they can do tests for RSV, and again, they can treat the symptoms. I want to look again at the graph on the right, and it's the same with flu, where we are seeing RSV much earlier in the year than we normally do. So again, we're taking a look at that dark blue line. That is this year. And you can see that in past years, the spikes have been between early December to around March. So it's definitely already respiratory illness season is here. And we want to make sure that we're taking every precaution that we can. Next slide, please. Talking about precautions, what are some ways that you can protect yourself and your family this winter? So the most obvious way, and the way that, of course, public health is encouraging you the most, is to get vaccinated. If you're not already vaccinated with your booster, we encourage you to get your COVID-19 booster. If you're not vaccinated for flu, now is a great time, and we have it for free around the county where you can get it. Of course, flu is also available at most pharmacies, as is COVID boosters. If you are sick, stay home. Definitely stay home. You're protecting yourself, you're protecting your family, and you're protecting other people around the community. Consider testing. We definitely have test kits still available around the county. We have them at our 8 community centers. We have them available at both of our WIC offices in Stockton and Manteca. And we have COVID-19 tests if you want to come into our office. Public Health Services, we're off of Hazelton Avenue in Stockton. Consider wearing a mask. I know a lot of us do not want to put masks back on, but especially if you are experiencing symptoms and you have to go out for some reason, you want to make sure that you're putting a mask on to protect other people. And if you are someone who maybe is high risk for COVID, then you might consider putting a mask on if you're going to an indoor public place to protect yourself. Washing your hands is arguably the easiest way that we can prevent infections. So continue to wash your hands with soap and warm water for 20 seconds, or use hand sanitizer if soap and water are not available to you. And then cover your cough and sneeze, another very easy way to prevent infections. And we call it the vampire cough. So coughing into your elbow, the vampire cough. Or go ahead and do it into a tissue. Just make sure that you wash your hands after you sneeze or cough. And I think we're wrapping up here, Tony. The next slide should be maybe questions, if anyone has any questions.
Awesome. So what I will do is say this: if there's anyone, if we have any viewers right now that have any questions, and you want to just drop them in the chat or on your comment, they will pop up. They will pop up on our side, and we will be able to see them. And that is at any point. The other thing that I want to do is I want to encourage folks to share this live video, share it on your social media, tag folks to add them in order for them to access it and get information for it. And I will be able to actually drop in all of our social media spaces, the YouTube link to it, so that you can text it as well to folks that you need to have updates on this information. Pastor Nelson.
Hello, everyone.
Buenos tardes or noches?
Buenas noches. I think it's good night. At this point, it's dark enough.
Thank you for joining us this evening.
Thank you for the invitation.
So I know that I was talking to Pastor Nelson earlier and mentioned to him that we haven't always had someone to translate in Spanish for us. And so what we want to do also is bring back another conversation that is in Espanol in order to ensure that our Spanish-speaking community is able to engage and has the information as well. So I think that I have a couple of questions. And I think that I know that Mary has some questions. I kept wanting to say Nicole. Mary has some questions as well. So let's go with Mary first.
Awesome. Thank you so much again, Elder Tony, and welcome, Pastor Nelson. Thank you for joining us tonight. My question for you, Alex, is thank you for covering the COVID, flu, and the RSV viruses that we have circulating right now. I wanted to know if you can inform the community about the tridemic term that is going around right now. So that way they are aware of this term and they're aware of the viruses that are out there.
Of course. Yeah. Thank you so much, Mary, for bringing that up. So tridemic, tripledemic, there are words circulating like that, but basically it means that we're dealing with multiple respiratory viruses that are circulating throughout our communities, getting people sick, sending them potentially to the hospital. And why we need to be aware of this, of course, we want to prevent ourselves from getting sick as much as possible. But the other part of it is to make sure that we're not overwhelming our hospital system. So getting a vaccine, doing infection prevention methods like washing your hands, different things like that, as long as we can make sure we're not straining our hospital system. So if people really do have very serious forms of illness, that they're going to be able to be treated and seen immediately. So the tripledemic, I think we heard it a few years ago as well. They were calling it a bidemic or a twindemic or something like that.
Right, so the twindemic is COVID and flu.
Right, exactly.
I just heard the term tridemic a couple days ago at an event. So I definitely wanted to address it here. So that way when the community hears it, they know exactly what we're talking about, or they know exactly what viruses we're talking about in the twindemic.
Yeah, so it's the ones that we talked about in our PowerPoint. So it's COVID, it's influenza, and it's RSV right now. And again, we've been seeing those much earlier than normal in the year for flu and RSV. And we're seeing it at rates that are kind of unprecedented for this time of year. So we definitely want to make sure that we're monitoring our symptoms, taking care of yourself, making sure that you're nourishing your body with good foods, you're getting enough sleep, and you're doing your basic infection prevention methods on a day-to-day. So if you do hear that term, it means COVID, flu, and RSV. That's what's circulating right now.
Thank you so much, Alex, for that.
All right. I see Chris maybe put something. So Chris said, how can CBOs and FBOs partner with the county to host flu vaccine events? So public health loves to speak in acronyms. So I don't know, if people know CBO. So
So a community-based organization is the CBO. What's the FBO?
Faith-based. Yes. So it's a faith-based, which is the churches, clergy.
Mm-hmm.
CBOs, okay. I call the faith-based LOCs, but okay. So got it.
What does LOC stand for? I'm sorry.
Local organizing congregation or community.
Okay, I didn't know that one, so thank you.
Yeah.
Okay. So how can we go about doing that? Of course. So there's a few ways. We have a few teams that are available to us. We do have an internal strike team, which is just a group of nurses that belong to public health that are very qualified, very ready to mobilize whenever they need to be. And then we also have another team available to us right now that's provided by the state, and they're called SNAP Nurse. If anyone's gone to one of our mobile events, you've probably met our SNAP nurses. They are amazing, and we're so thankful for them. They've been able to increase our vaccine numbers, make sure that we have a lot of events going on at any given time. So we have basically two ways that we can host vaccine events. Both our nurses and SNAP Nurse are both qualified to host flu vaccine events. They carry flu vaccine on them all the time. So you can always ask for a flu vaccine. How can you go about doing it? Let me get to the answer here. You contact public health. So Mary has our IZ email. It's sjc_iz@sjcphs.org. If you email that IZ inbox, I am the person on the other side of that, and I will get your email, and then we'll go ahead and contact you, get the event information, and then we can go about if you need help creating flyers. We can help you with that. We can put it on SG Ready. So you just give us a call, email us, and we'll get it set up for you.
And Alex, I know Chris specifically asked, sorry, Pastor Nelson. I know Chris specifically asked about flu, but your strike team actually has other vaccines available as well that they can bring to the site, right?
They do. So our strike team has, of course, all of the COVID vaccines. So they carry all of the primary series, Pfizer, Moderna, and Novavax. We no longer carry the Johnson & Johnson because of some of the complications that were happening with that vaccine. But they have all of the primary series for Pfizer, Moderna, and Novavax, and they have the updated boosters, of course. And like you said, they carry the flu vaccine. We have two types of flu vaccine. We have the nasal spray flu vaccine, and we have the traditional getting a shot in your arm flu vaccine. So, and then the last vaccine that we carry is the Mpox vaccine. It's called Jynneos. So we do carry that. It's a 2-dose series. So we will have to come back out. If you request us, we'll have to come back out 4 weeks later to see you again. But yes, we do carry the Mpox vaccine as well.
Thank you for that.
Hi. I just wanted to highlight the fact that thank you again, Alex, and everybody here, Pastor Elder Tony, for putting this together. Last Sunday, for example, we had a vaccination event at our congregation, our church, in conjunction with Faith in the Valley, Vaccinate 58, San Joaquin County. And we were able to offer the flu vaccine, COVID-19, the bivalent vaccine as well, and all the, like you mentioned, and the Mpox. So we were happy to say that all the vaccines were offered, and we had a good number. So 36 people were able to get vaccinated for flu and COVID, and 17 for Mpox, including myself, my spouse, and my daughter. And what I wanted to say about that event in particular is that if there are churches out there, one of the services that we are offering as Faith in the Valley is that they can call me directly, and I can help them facilitate free of charge, right, Pastor Tony? free of charge. We can help them coordinate with Vaccinate 58, which is the state initiative for vaccination, and with the county. So if you're a faith-based organization, we can help you. Just you can call me directly at my cell phone 267-977-0601, and I can help you coordinate. And when you mentioned the flyers, we can help with the flyers as well. We have done that for other congregations and to increase the numbers. So any way we can help, we're here to facilitate churches. We know I'm a pastor myself, how hard it is to coordinate all this stuff, but we can be like a middle person to help facilitate this process. So thank you, Pastor Elder Tony, for hosting this event.
Okay. Do you want to say that in Spanish just in case somebody that is okay? Go ahead, please.
Sure. Quiero informarle primero, gracias a la reverenda Tony McNeil y a todos los presentes que están aquí, gracias por este evento. Quería informar que como parte del trabajo que hacemos en Fe en el Valle, en Faith in the Valley, es que ayudamos a congregaciones, iglesias, grupos de fe a organizar clínicas y libres de costo, como parte del trabajo que hacemos en Fe en el Valle, es ayudar a congregaciones, a iglesias, grupos de fe a organizar clínicas de vacunación, y nosotros les ayudamos a coordinar con el condado y también con el estado, porque el estado tiene unos ofrecimientos, como por ejemplo pueden ofrecer, que usamos la semana pasada, camión de comida gratis y también transmisión y promoción del evento a través de la radio. Así que tuvimos un evento la semana pasada y fue muy importante utilizar tanto los ofrecimientos del condado de San Joaquín como los ofrecimientos del estado de California. Mi teléfono, si están interesados, es el 267-977-0601. Padre Nelson, me pueden llamar y con gusto le ayudamos a coordinar estos eventos. De nuevo, libre de costo. Esto es parte del ofrecimiento que hacemos en Fe en el Valle. Gracias.
I thought I was going to be brilliant, right? And keep up with your telephone number in Espanol. But yeah, after 209, you lost me. My brain was trying to interpret like the next number. I was like, forget it. I know his email though.
When you start dreaming in Spanish, you know that you're making it. So that's what happened to me when I moved to the U.S. 6 months later, you start dreaming in English. So,
oh my God, I can say in esquina, izquierda, yeah, it's derecha. Yeah, there's a whole lot of things I can do on a drive test in Espanol. So, are there any more like questions that we have from anyone that is in the space right now? I don't see any more questions in the chat. Scrolling through there to make sure. Mary, did you have any other questions that you needed to ask or to anything you needed to lift up?
The Tamiflu treatment that you spoke of for influenza, is that something that folks can receive over the counter, or is it prescribed medication?
Yeah, it's a prescription medication.
Okay. Mm-hmm. Okay. Thank you. That was it for me.
Okay, so give me 1 second. I want to lift something up before we shift.
I need to go, but I just wanted to say goodbye, everybody. I'm being called, but blessings. Sorry, I have to leave.
Thank you again for joining us, Pastor Nelson.
Thank you so much.
Anytime. Blessings to all. Bye-bye.
So the at-home testing kits, I know that you've given us places that we can pick them up. I want to make sure that everyone knows that you're no longer able to order them from the Postal Service, from what I understand. And you can reach out to public health advocates if you need to find out where you can get them, other than from any of the organizations. If you're not comfortable going to, the health office, you can reach out to Mary Davis directly. If you want to find out, what more you can do in the community, you can reach out to public health advocates through their COVID flu program, and they will assist as far as getting that information out to you. So the work that we do when it comes to COVID flu is specifically catered to the San Joaquin County, and so we want to make sure that that you know that. But let me say this now: if there are any questions, hi Pastor Kelsey West, I see you on there from Las Vegas. If there are other folks that tap into this and they need information for their state or their city, do not hesitate to reach out to me. Email me. Or inbox me on my social media platform, Tony McNeil, and I will do due diligence. Y'all know I'm like tenacious when it comes to reaching out to folks and gathering information. I don't have a problem harassing y'all public health department or having Alex call down there until she finds somebody that I can call and harass. Right, Alex?
We love it. Keep the questions coming.
But once again, just making sure you all know there aren't any, you are not able to actually use the Postal Service in order to get COVID tests any longer. So I don't care what state you're in, what city you are located in, you're going to need to make sure that you can go to, you should be able to go to Walgreens, you should be able to go to CVS, any pharmacy. And as long as you have insurance, how many do they have access to right now?
Typically it's 8 a month.
Okay. So you should be able to get up to 8 free tests a month. And you shouldn't have any issues with getting those tests. And then your public health department should be able to get you access to them for free. For those of you that are in Stockton, I keep a batch. I deliver them to the churches. So Faith in the Valley has tests that we can distribute. Our concrete team, we go out randomly and just distribute them to the block. That means that if you tap in to COVID conversations because you want to know #COVID WTF, and you need a test, yes, we got the homies, the big homies, the little homies, the OGs, and the triple OGs. They will make sure that you get a COVID test. If you at home and you like, I ain't finna go out and be bothered with them folks, but I think I got that thing. We got some folks that'll bring it to you. They don't have a problem. Make sure that Advanced Peace has access to COVID tests. So if you need them and you on the block and you just don't, you know what I'm saying? Y'all know who I'm talking to. Then go ahead and reach out to one of the NCAs and they'll hook you up, right? We got the plug so we can get you set up with a COVID test if you need one. Other questions that we did have real quick is, so our count isn't necessarily as high. Something that Mary did bring up that was kind of curious to me. So for folks that test positive for COVID and stay at home and just kind of ride it out, is that a problem? Do we care? Like,
not at all. No. Our test rate that you will see either on our dashboard or on the state's dashboard are only calculating the PCR test. Okay. So those are tests that are done by a specific nurse or someone that's qualified to perform the test, and then it's sent away to a lab. Okay. So that's what's counting that. It's not counting the people who are taking at-home tests or people that choose not to report them or whatever it is. We have no issue with you taking your test. If you know that you're positive and you're staying home and you're writing it out, you're doing the right thing. That's exactly what we want you to do to try and decrease the chances of you passing it on to someone else. Great. We don't need you to report your test. We want you to not get anyone sick and get better. That's what we want. So if you do experience symptoms, again, we are really pushing the test to treat. We don't want people to get long COVID. We don't want people to be sick with COVID for 3 weeks even. That's really putting you out. And especially this time of year, no one wants to be sick for that long. So if you do have symptoms, I would say stay home, but you can go into one of our test to treat sites and get your medication then and there, and then get better quickly.
Okay.
And I have a quick question in regards to our test to treat sites. It's okay for those who are not vaccinated to go to these sites, right?
Of course.
And get
absolutely treated. Yeah, it's for anyone experiencing symptoms of COVID-19. Your vaccine status is not a factor in that.
Okay.
Thank you.
Okay. I appreciate you asking that question too, Mary, because right now there's so much tension, you know what I'm saying?
Mm-hmm.
Between folks that are and are not vaccinated. And at this point, that was a question that I have. So
We
where
used to
are we
call
with
it the
that?
vax versus the non-vax.
Yes, girl, we're gonna have a COVID conversation about that. Vax versus non-vax, right? To be vax or not to be vax. That is the question. But with the where are we with the vaccines? Like, have we I got so many questions now. I can't even bring them up tonight. I want to know more about herd immunity. What's that? But as far as the county of San Joaquin, have we reached the numbers that we're trying to reach when it comes to those being vaccinated? Are we now striving for boosters?
Yeah, so a few things. We're at 70% of people in our county who have received at least their primary series. Fully vaccinated
Primary
still
series
means,
means what?
right. Let me get into that. And fully vaccinated is kind of a complicated term now, too.
Okay.
So primary series means you either got one dose of your Johnson & Johnson vaccine or you received 2 doses of either the Novavax vaccine or one of the 2 mRNA vaccines. So that's Pfizer or Moderna. So Johnson & Johnson is the only one that was just 1 dose. All the other 3, Pfizer, Moderna, or Novavax, were 2-dose primary series. Now, you are considered fully vaccinated as long as you have completed your primary series of one of the 4 vaccines that have been available to you. So anyone who is boosted, you're not more fully vaccinated than other people. Fully vaccinated is just people who have completed their primary series, and that is it.
Wait, so I'm boosted and I'm not like juiced up extra? So I'm not like extra
You are.
protected?
You have better protection, but just as far as the term fully vaccinated,
Okay.
someone who just did their primary and someone who's boosted, you're both fully vaccinated. One of you is just boosted. So we're definitely recommending the new boosters again because they have something in there that is the viruses that are circulating right now. So that's going to protect you better. When the COVID vaccines were first developed, of course, those were completely different variants that were circulating than they are now. So definitely recommending that. Tony, did I answer your question? I'm so sorry.
No, you did. You're doing good, Alex. You're doing good. I promise you, you are doing really good. So, okay. Yes, 70%. We've reached 70% in the San Joaquin County.
Yes.
We are now still encouraging people to get the vaccine in order to be fully vaccinated. However, you don't have to be the booster shot. If you have the vaccine, if you have both doses or just the Johnson & Johnson, you are fully vaccinated, but you're not juiced and vaccinated like Elder Tony is, because Elder Tony, she got the fully vaccinated thing, and then she got the plug, right, where she got a booster shot, and then I'm gonna get double juiced because I'm gonna go and get that other new thing, right? Because I went to the White House, y'all, quiet as kept. That's when I got COVID. I got the COVID from the White House. So
yes. So Tony, you're great. So glad to hear that you're boosted. I got my updated booster a few months ago. But for those, we have an amount of people that they really wanted to just kind of see how the vaccines worked. They wanted to see other people get vaccinated and make their decision later. So we still see today. I was at a vaccine event at a school, and I saw quite a few kids get their primary series done today, and I think that's just fine. Just because it's not now doesn't mean it's never. And sometimes people just need more information, to make that decision, and that's just fine. So of course, we always want more people to get their vaccine, raise our number of people that are fully vaccinated in our county. But I think we've done a really good job here in our county. And thank you so much. It's spaces like this that are informing people. And we call it informed decision making, right? So as much power and knowledge we can give people to make that informed decision, we are still going, still want to get that information out there. And for the people that maybe are still undecided, it's still important that they get the information. So maybe they can make that decision at a later date.
And I have one more question, and that will lead us just to wrapping up. I still have senior citizens that are like terrified,
Mm-hmm.
and they're just as terrified as day one.
Yeah.
And so I'm curious, especially with the news and the news narrative, all that is out there.
Mm-hmm.
At this point, I'm just curious as to, do we still need to be as terrified and traumatized as day one?
No, I think we've definitely seen with our variants that they've become maybe more infectious as far as they can spread more easily. But we have seen that they're causing less severe disease as time goes on. So that's one note. The other thing is we have a population that is much more vaccinated than was even just a year ago. So you are really, with vaccines, you're limiting the amount of severe disease and hospitalization that you can get. And so if you have a vaccine and you get COVID, a lot of people experience mild symptoms. Now, again, I think with the Paxlovid, with our test to treat sites, even if you're vaccinated and you get COVID and have symptoms, I would still recommend you go get a test to treat and go get your Paxlovid treatment, because that reduces hospitalizations by 51%.
Oh, wow.
The data is there for the treatment. So, I would say if you're sitting there scared, I wouldn't necessarily think that's a healthy mindset right now. We have the tools. We know what works, right? So get your updated booster if you haven't already. We're definitely recommending that for older adults, especially. And
does that mean like me?
Well, for me, I think everyone should get it. But older adults over the age of 65 are definitely considered high risk.
Okay, not yet. Not yet. All right.
So if you're over 65, you are considered more high risk. I definitely would consider getting your updated booster as soon as you can. But we're in a much better place now than we were.
Okay. Alex, you're good with this. I like you. I'm gonna have to rock with you a little bit more.
Well,
Mary, look, Mary, we might have to bring her to our next COVID conversation, the mark of the beast.
Oh, yes, I would love to. And Alex knows I bother her all the time. She's like my direct contact for public health services. So I am so appreciative of you coming and joining us tonight and just giving all this great information. It's very much needed, and you delivered it so well. So thank you.
Well, thank you. I appreciate you having me. Thank you so much.
So you guys, we're gonna tap out. This is our monthly COVID conversation. Tonight was just an update to let you know, just where we are, especially with the holidays and travel. Definitely make sure you're wearing your mask in the airport, on the planes, all of that different stuff. Because look, at this point now, just whatever. Ain't no telling whatever is out there. It's just wear your mask. Wash your hands. If you're sick, stay home, right? If you're sick, stay home.
Say it again.
Girl, you know I am, right? Come on now. In the grocery store, hacking up a lung. Come on, just stay home. That don't make no sense. Sweating profusely because you got a fever, go home. Ain't no reason for you to be in the grocery store touching everything and spreading germs and cooties and stuff. Stay home. Call somebody. Look, text somebody. Ask Uber. Anyway, okay, get off your horse, Tony. You stay home if you're sick. If you do get COVID, if you take the rapid test and you have and you're positive for COVID, it is recommended that you go to a test to treat site in order for them to give you the medicine for it. It reduces 51% chance of you being hospitalized by it. Don't have to be as fearful as we were when it first dropped, right? We're developing the tools and people are vaccinated. And if you're not vaccinated, you see that, folks like me still here, my hair's still growing, I ain't got no horns and no bumps and stuff. And I think I'm still saved and Jesus still loves me. We're going to talk about this mark of the beast thing next month. But yes, so get your vaccine and encouraging you to get boosted. So last but not least, Mary, there is an event that you wanted to tell us about that is coming up. Let me see if I can share my screen. Don't know.
Yes,
Yeah.
I'd love to let everyone know. Public Health Advocates is joining with Razor Barbershop to put on a toy drive this weekend, Saturday, December 10th, 10 to 2 p.m. We will have free food available to the public. We will be offering free haircuts, free vaccinations. There will be raffles and gift cards, and we're also doing 2 raffles for bikes. So if you are available and you have children, please come out and join us. We will be at Razor Barbershop this Saturday, 10 to 2 p.m. And I will definitely share this flyer on Facebook, and I'll send it over to Elder Tony to share as well.
Nice, nice. I did it. I did it. All right, y'all. So we will see you guys next month. If there's any startling anything that comes up, we'll definitely be back with an update for you as soon as we get any news. We're staying in those spaces. Public health advocates, once again, just giving them a super shout out. You can reach out to Mary Davis. That is her contact information. I want to make sure that you guys remember, if you go to sjready.org, they've got all kind of goodies and information for you that is there for you to have access to that. If you have questions, I need you to know that you can contact Public Health Services. All of this information is in the chat for you. And just in case you forget, Razor Barber, they are having an event this Saturday at 10 a.m. From 10 a.m. to 2 p.m. And I think
free food, free drinks, toys for the kiddos. We'll have activities and free haircuts. Who doesn't need a free haircut? Come out if you are available. So, Elder Tony, maybe they can line you up.
Stop playing. Stop playing. So we will be coming to you next month. Mary, are we going to be doing the same date, same time?
Yes, let's continue to do, is it the second Thursday?
Every second Thursday, 6 p.m. And so second Thursday, 6 p.m. next month, we will be back with a COVID conversation. And hopefully next month, we'll be able to talk about the mark of the beast. I want to know. We're going to have some clergy here with us because we need to, I want to know.
That makes me a little nervous, Elder Tony.
Oh, please. With the mark of the beast. I'm like, wait a minute. Do you know Jesus? You don't know him and you're telling me? Okay. We're going to save that for next month. All right, you guys. I'm going to have my crew. Y'all stay with me. I'm going to go ahead and take us off. We're going to end the broadcast. So you guys have a good evening. Be safe.
Good night,
if you're sick, stay home. Stay home if you're sick. Bye.